Our plan is about what we need to do around a national strategy for contact tracing, for testing, for administration of the vaccine, and making sure that it will be free for all. That is the plan that Joe Biden has and that I have, knowing that we have to get a hold of what has been going on.
What does that mean? Joining me now is Dr. Jay Bhattacharya, Stanford University epidemiology professor, who was at the White House over the weekend for this very important roundtable discussion on how to tackle COVID. Dr. Bhattacharya, the Biden campaign, they keep this going, right? They don't want to talk about the rolling lockdowns and shutdowns that have to be part of this mythical plan they have. But haven't we seen that just inflame the situation with all of the hospitalization increases going on now in Europe after they locked down for all that time?
Yeah, I mean, it really seems like the contrast is clear. The Vice President Biden's plan seems to focus on mask mandates, more testing, contact tracing, whereas President Trump's plan seems to be more toward opening the economy up, opening up states, protecting the vulnerable. Those are very, very sharp contrasts, I think. Both, I think, favor vaccines. Both favor, I think, development of treatments. So I think that there's not much difference there. But in terms of the lockdown strategy, I'd say Vice President Biden's plan is much more in favor, in line with lockdowns than President Trump's.
Well, President Trump said something about the therapeutics versus the vaccine route today. Watch.
Now they call them therapeutic, but to me it wasn't therapeutic. It just made me better. Okay, I call that a cure. So I want to get these things done. So we have to get them done. We have to get them approved. I want to get them to the hospitals where people are feeling badly. It's much more important to me than the vaccine. Dr.
Bhattacharya, do you agree with that?
I mean, if we have effective therapeutics, that would be an enormous advance. And it, sure seems like he got better awfully quickly. I mean, if the data that I'm seeing for these antibodies hold up, I mean, I think he could be right. I mean, obviously, we still need to wait to make sure the FDA does its due diligence to be 100%. Very you want to be certain. But I think President Trump, I mean, the outcome for him seems to have been quite good, actually.
And Dr. Bhattacharya, on this issue of what next for the country, the Democrats are pointing to, and Fauci the other day is like, there could be 400,000 dead by January, February if we don't do social distancing and masks and avoid inside gatherings and no one goes to Thanksgiving. And I'm kind of being facetious here, but you get the point. Fauci is always Mr. Negative. There is never any good news. There's never any good trends. Your reaction to what we're seeing across the country with the increase in cases in some places?
I mean, I think, for one, I think that it's very short-sighted to ignore the cost of those lockdowns in terms of health. Those lockdowns have come at an enormous cost, and we heard a little bit about it in the last segment. People delaying treatment for chemotherapy. People, 1 in 4 Americans young adults have seriously considered suicide in June. I think the cost of the lockdowns are absolutely enormous. And I don't hear that when I hear some of the public health officials that talk about this, which really distresses me. I think you can't just look at the benefits, so to speak, of a policy, of the lockdowns, which is maybe reduction in cases, although that I think is also in dispute. You also have to look at the costs. And I think, so looking at case numbers, really, that's not the right metric. We obsess over cases, but what we really should be thinking about is, are we protecting the vulnerable? Are the things that we've adopted, the policies adopted, are they having collateral damage? And I think at this point, it's pretty clear that the collateral damage from the lockdowns that we've had over the last several months have vastly outweighed, or at least started to vastly outweigh the benefits.
Yeah, Dr. Bhattacharya, I was in D.C. this morning, okay, 10:30, 11 a.m. It's usually bustling, crowded, lots of people. Empty, okay? D.C., small business, they're dying in D.C., okay? Those are real lives, too. Dr. Bhattacharya, great to see you again this week. Thanks so much.